All right. So for the assignment, you've got issues, policy analysis. I think what we all decided to come up with here is what has been a topic of conversation in my workplace for quite some time, which is what I'm affectionately calling the Medicaid loophole for inmates. So what that means is that if you are incarcerated in Utah, whether that's in Salt Lake or Utah County, uh, if you need to get into a substance use program, but you don't have Medicaid, you will have to wait until you are no longer incarcerated to apply for Medicaid. This is a particularly problematic for me because in my job, and this is kind of the context of where this comes from, is most substance use programs who are Medicaid, who accept Medicaid, they require that the Medicaid is active prior to the individual coming into treatment. The reason I found that they want this is because one, they want to get paid for the services that they provide for that person, but two, sometimes when people come into residential substance use programs, they don't receive Medicaid billable services right away. Sometimes your first introduction to residential is getting in, figuring out where you're sleeping, how the house works, and you might not receive your first Medicaid billable treatment until 3 or 4 days later. A big problem in residential treatment is that people typically abscond within the first week. So if that treatment provider has been trying to help them sign up for Medicaid, not incarcerated, and they leave in the first week, they're actually potentially out money or funding because that particular individual has left before their application gets completely processed. Something that I know Medicaid does is it backdates all payments. If someone is applying for Medicaid and is already receiving services, that provider can receive payment for those services, but the Medicaid has to be active. If they leave treatment prior to that, it's not going to happen. So the loophole that I've been trying to overcome at work is how do I help somebody apply for Medicaid and have it ready for them when they get out of incarceration. And that's been challenging because Medicaid is not they won't even accept the application from me until I can put on there the date that they're no longer incarcerated. So yeah, that's sort of the kind of context of the problem and the issue, around it. I guess we want to move on to the problem statement.
Okay, it's me, Reina. So thanks to Raquel, we found out that the problem actually started in 1965 with the inmate exclusion policy in the Medicaid coverage piece, I guess. So it has been going on for a while. And the part of the problem is part of the reason it should be addressed by social work professionals is because we have a duty and to treat our clients with dignity and to try our best to help set them up for success. And the delay in services from something like receiving Medicaid is contributing to their decline in mental health and causing them to be a delay of treatment. I'm so nervous. I'm so sorry. A delay of treatment, which then in turn causes there's a bigger chance that they will fall back into their old patterns where rehabilitation cannot occur. Rehab programs are designed to reduce recidivism among adults, and it is also set up to help with improving their behavior, skills, and mental health services, social functioning, and access to employment and education. So when an inmate is being released from jail, the lapse in time it takes from them to get to jail to get their Medicaid into rehab can be very detrimental to them receiving the care they need to be a functioning member of society in order to not have them go back into jail. Let's see. The other issue is some of the inmates, when they are released and they don't have health insurance, if they have other mental health issues or just even physical health issues, diabetes, other kinds of illness, they are also being delayed for care in that area too, which then also sets them up for failure because they are going to quickly seek out other means of care, which may not be the best, which would just then in turn set them up for a repeated incarceration / release cycle that they may be in. And I think that's about all I have.
Great. So I guess now onto our position on the issue. I'm reading on behalf of India, who could not be here, but emailed us her part in it. And she wrote, access to healthcare is a human right, and it is crucial that everyone, including those who are incarcerated, have access to healthcare services. Incarcerated individuals have historically been denied access to adequate healthcare, despite being one of the most vulnerable populations. The United States has the second largest number of prisoners worldwide, holding almost 2 million people. Many of these individuals come from low-income communities where healthcare is either inaccessible or unaffordable. Medicaid is a joint federal and state program that provides healthcare coverage to low-income individuals and families. The program covers a wide range of medical services, including primary care, hospitalization, and prescription drugs. However, those who are incarcerated are not eligible for Medicaid coverage, and this creates a significant barrier to accessing healthcare services. I believe that those who are incarcerated should be allowed to apply for Medicaid. One of the reasons I believe in this is because they face a high risk to health problems. Incarcerated individuals are more likely to suffer from chronic illnesses, mental health disorders, and substance abuse issues than the general population. Other people who are incarcerated struggle with poor living conditions, lack of access to healthcare, and high rates of stress and trauma. Incarceration itself can also have negative health effects, such as an increased risk of infectious disease and exposure to violence. In our Learning Circle group, we read about a guy named Tony. Tony was in and out of jail for gang violence, theft, and drug distribution and use. There was a variety of factors that led to Tony being incarcerated from a young age: his environment, trauma, those around him, and lack of resources. Tony talks about his struggles with AIDS, getting help for his drug addiction, and mental health issues, which eventually led him to attempt suicide. In the book, Tony mentions that he did not know how to get help and that he felt like he was better off in jail. Another reason why I think those who are incarcerated should be able to apply for Medicaid is that the healthcare services in correctional facilities can sometimes be inadequate. Those who are incarcerated do receive medical services while behind bars, but the quality can change depending on the facility or the staff. Many facilities are overcrowded, understaffed, and lack the resources to provide adequate healthcare services. This can lead to delayed or inadequate treatment or worsening health conditions. By allowing those who are incarcerated to apply for Medicaid, we can ensure that they have access to the healthcare services they need. Medicaid coverage can help incarcerated individuals receive the medical care they deserve, and that can help their overall health and reduce the risk of complications. Tony needed more resources when he was transitioning back into the community. Mental health services would have been beneficial for Tony because of the poor coping skills and mindset he had from his trauma. Some believe that this is a waste of taxpayer money and unfair to provide free healthcare to individuals who have committed crimes. They feel as if they don't deserve it. Going into the social work profession, I think that refusing to let those who are incarcerated apply for Medicaid is counterproductive. We aren't going to see a change by denying healthcare services to incarcerated individuals. When we deny these services, we are keeping them in the same negative cycle that Tony was stuck in. Those who are incarcerated should be able to apply for Medicaid to ensure that they have access to healthcare services. Healthcare is a basic human right, and denying this service to those who are incarcerated is counterproductive and unethical. If we provide Medicaid to incarcerated individuals, we can improve their overall health and help them transition back into the community. It's time for policymakers to recognize the importance of healthcare for incarcerated individuals and get them access to the services they need. And so, and then onto the counter position. The counter positions I could find on this issue are that there is legislation already implemented to remove freedoms from individuals who have spent time in jail or prisons. And then removing the freedoms is a value that was held to the purpose of the initial purpose of the criminal justice system. So when Medicaid was established in 1965, they included the inmate exclusion policy to shift the sole responsibility of healthcare to state and local government and to prevent them from receiving matching federal funds to cover the healthcare cost of people in state prisons and local jails. And so when this guideline was proposed, prisons and jails solely focused on punishment and holding people responsible for their crimes. Mental health issues and substance use were not yet linked to crime. But as more research has come out to prove that many individuals who are incarcerated have mental or substance health issues, and in order to minimize recidivism, proper treatment efforts are needed upon release. These individuals are usually eligible for Medicaid assistance. However, the time gap between their release and registration to treatment centers makes them ineligible under the inmate exclusion policy. So some policies that support the counter positions are two bills that were between 2021 to 2022 were introduced to amend the inmate exclusion policy and allow for inmates to receive Medicaid assistance prior to 30 days before their release. However, both bills were not passed, and hesitation towards allowing Medicaid assistance in correctional facilities is due to Medicaid needing to establish a standard of care and services within the facilities and setting up billing and record keeping systems. Other states have worked with CMS, so the Centers for Medicaid and Medicare Services, to allow for pretrial detainees to have their benefits suspended instead of revoked, but Utah is not one of those states. And so the public view on the counter position is that removing Medicaid access to inmates follows the stigma that individuals who are incarcerated are to be stripped of all their freedoms as punishment. And then efforts to transform the criminal justice system into a rehabilitation-based system are still in its early stages. And ways to integrate assistance programs like Medicaid into correction facilities to further support treatment efforts still need to be figured out. And the potential unintended consequences for the counter position are continuous high healthcare costs for state and local governments, lack of healthcare services for individuals incarcerated before, during, and upon release, poor quality of care, lack of potential treatment services upon release, higher rates of recidivism and death, and negative effects on families and communities. The social work literature that we read, how it connects to this counter position was that reading the face of social suffering emphasized issues in the criminal justice system and its efforts towards rehabilitation into society. As we were following Tony's life story in and out of prison, we saw how the system did not act as a place for Tony to seek treatment in order to prevent him from returning. It further encouraged his criminal activity, and Tony's lack of treatment while in prison was less likely to happen since prisons are responsible for the cost and usually are charged double for healthcare services. And that's the counter position on our issue.
So my area was that to identify areas for possible compromise and refinement of positions based on our analysis of the issue. According to the operations director of Medicaid and Health Financing, an estimated 80% of individuals released from prison in the United States each year have a substance use disorder or chronic medical or psychiatric condition. According to the Bureau of Justice Statistics, 53% of all of these state prisoners and 45% of all federal prisoners met the DSM-IV criteria for drug dependency. It has been reported that Utah statistics are very similar to these federal statistics. The survey done in Davis, Weber, Tooele, and Washington County jails reported the number of inmates with mental illnesses has continued to increase, and almost 49% of individuals involved in the justice system will need continued substance abuse treatment once released. As my classmates have discussed, many of these individuals experience a gap of Medicaid coverage, causing them to have the chance of relapse and going back to their criminal activity, or even being denied release. One way to prevent this is to allow Medicaid to be applied for within at least 30 days of release, if not sooner. This will allow these high-risk, high-need individuals to have a smoother transition from incarceration to treatment and mental health services, especially inpatient treatment facilities. Another way to resolve these barriers is to change how some of the substance abuse block grants are dispersed. For example, Salt Lake City currently has a substance abuse block grant that is able to bridge the gap for those needing substance abuse treatment for Salt Lake City residents. The problem is, if someone who is currently incarcerated is accepted into an inpatient treatment program in Salt Lake City, but was not a resident before incarceration, they are not eligible for these block grants. One way to resolve these problems is to make this statewide grant and allow any Utah residents to receive these funds to any treatment center throughout Utah. These are just a couple of the ways to compromise or readjust some of these Medicaid policies, which will allow individuals a smoother transition into substance abuse treatment and mental health treatments.
Wow, you guys. That was amazing. That was so good. Like, I feel like I could take this Zoom meeting to like policymakers and be like, this is just a bunch of students who figured out how to help you guys clean up your house.
Yeah, it's
Well, there's only 4 minutes left in the Zoom call, so I guess we'll call it there. But congratulations to all of us on that. That was amazing.
yeah. I liked all your guys' points and everything. I'm gonna stop recording now.